Before learning the anatomy of the hand, it is important to know the arrangement of tendons, arteries, and nerves in the region of the wrist. In this video, we will explain the region of the wrist. Upon finishing this tutorial, you will be able to identify the structures on the anterior aspect of the wrist, the structures on the posterior aspect of the wrist, and the anatomical snuff box, which is an important area on the lateral side of the wrist. Let us start by talking about the structures on the anterior aspect of the wrist. The flexor retinaculum, or transverse carpal ligament, is a rectangular fibrous band situated on the ventral aspect of the wrist. It encloses and forms the roof of the carpal tunnel. You can check our video on the carpal tunnel for more details. The structures that pass superficial to the flexor retinaculum from medial to lateral are the tendon of flexor carpi ulnaris, which ends on the pisiform bone, and so does not cross the flexor retinaculum. The ulnar nerve, the ulnar artery, which lies lateral to the ulnar nerve, the palmar cutaneous branch of the ulnar nerve, the tendon of palmaris longus, which passes to insert into the flexor retinaculum and the palmar aponeurosis, and finally the palmar cutaneous branch of the median nerve. The structures that pass deep or beneath the flexor retinaculum from medial to lateral are the tendon of flexor digitorum superficialis and deep to it, the tendon of flexor digitorum profundus, both of which share a common synovial sheath, the median nerve, the tendon of flexor pollicis longus, which is surrounded by its own synovial sheath, and finally the tendon of flexor carpi radialis. Moving on to the dorsal aspect of the wrist. The extensor retinaculum, also called the dorsal carpal ligament or the posterior annular ligament, is a fibrous band formed by the thickening of the deep interbrachial fascia. It crosses the dorsal aspect of the wrist obliquely. The ligament is attached medially to the triquetrium and pisiform bones, and is attached laterally to the anterior border of the radius. The ligament is also attached to the ridges of the distal end of the radius as the ligament crosses the wrist. The upper border of the retinaculum is continuous with the deep fascia of the forearm, and its lower border is continuous with the deep fascia of the hand. The main function of the extensor retinaculum is holding the long extensor tendons in place and preventing them from bowstringing. The structures passing superficial to the extensor retinaculum from medial to lateral are the dorsal or posterior cutaneous branch of the ulnar nerve, the basilic vein, the cephalic vein, and the superficial branch of the radial nerve. The structures passing deep or beneath the extensor retinaculum from medial to lateral are the tendon of extensor carpi ulnaris, the tendon of extensor digiti minimi, the tendons of extensor digitorum and extensor indicis that share a common synovial sheath, the tendon of extensor pollicis longus, the tendons of the extensor carpi radialis brevis and extensor carpi radialis longus, extensor pollicis brevis and abductor pollicis longus. Finally, let us talk about the anatomical snuff box. I'll select its module to illustrate its borders and contents. The anatomical snuff box is also called the radial fossa. It is an important triangular depression that lies on the lateral aspect of the dorsum of the hand, distal to the styloid process of the radius. It was given the name snuff box because this depression was used to hold snuff or ground tobacco before inhaling it via the nose. This triangular area has 3 borders, a floor and a roof. The medial or ulnar border is formed by the tendon of extensor pollicis longus, and the radial or lateral border is formed by the tendons of the extensor pollicis brevis and abductor pollicis longus. The proximal border is formed by the styloid process of the radius, which can be palpated here. The floor of the anatomical snuff box is formed by the scaphoid and trapezium carpal bones, and the skin forms the roof of the radial fossa. The main contents of the anatomical snuff box are the radial artery, the superficial branch of the radial nerve, and the cephalic vein. The radial pulse can be palpated in the anatomical snuff box as the radial artery crosses the anatomical snuff box and then turns medially to pass between the heads of adductor pollicis. The superficial branch of the radial nerve, found in the subcutaneous tissue of the anatomical snuff box, innervates the posterior surface of the lateral 3½ fingers and the associated area on the dorsum of the hand. The cephalic vein can also be recognized in the radial fossa, as it arises from the dorsal venous network and ascends to reach the anterior lateral aspect of the forearm.